Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier show for Tuesday, August 11th, 2020. We're going to get right into it. We're going to have Dr. Ira Fox join us. He's the medical director of the Surgery Center for Fort Lauderdale, Surgery Center of Fort Lauderdale, I should say. Also, president and founder of Anesthesia Pain Care Consultants, and we'll get into that as well. Dr. Fox, welcome to the program. How are you doing this evening?
Amazing. Thank you so much for having me, Dave. I appreciate it.
And thank you for joining us. I always say on this adventure of health because we learn so much from our doctor guests. So I see you. I hear you loud and clear. Let's get right into it. So the Surgery Center of Fort Lauderdale, is that an ambulatory surgery center or ASC, kind of a modern healthcare facility focused on providing same-day surgical care, including diagnostic and preventative procedures? Tell us a little bit about the Surgery Center of Fort Lauderdale.
Well, it's an ambulatory surgery center, but it's not just any ambulatory surgery center. It has a JCO certification, which is a joint commission that's very difficult to get. It's the highest certification you can have for an ambulatory surgery center. We have a lot of wind behind our backs and a lot of resources. We're partnered with Tenet Hospital Corporation. We're partnered with United Surgical Partners, the largest owner of surgery centers in the United States, I believe the world for that matter, over 300 centers. So there are a lot of resources, and more importantly, there's a lot of focus on quality. The quality control at the Surgery Center of Fort Lauderdale is second to none. We're extremely focused in every specialty we provide to have the highest level of quality and the highest standards that you can achieve with certifications.
So ASC's ambulatory surgery centers on the rise for care, most because of their benefits in care. Now, tell us a little bit that this surgery center, it's a same-day facility, right? It's an outpatient surgery facility?
Correct. Everything we do is outpatient, and the benefits are a much more streamlined process from the time you come in to the time you leave. It's very one-on-one attentive to our patients and the care we deliver, and it's a completely different experience that you receive in the hospital, for instance. I think that the idea of an ambulatory surgery center has really been perfected. It's probably upwards of about 30 years now that the idea of an ambulatory surgery center has been almost mainstream, and now it's probably the choice of most patients and physicians as far as delivering elective care.
Yeah, I know a lot with orthopedic surgeons I've had on the program, use a lot of ASCs, ambulatory surgery centers. What type of surgical procedures are offered at the surgery center of Fort Lauderdale?
Well, I've been there for over 20 years, and so obviously we do all types of interventional pain medicine procedures there, which my group does use the facility, well, pretty much exclusively. We do some procedures in hospitals, but mostly almost everything is done at the ambulatory surgery center. We do a lot of endoscopies, upper and lower endoscopy procedures. There are many gastroenterologists at our center that are very highly qualified and have been there for many years with a lot of experience. And we are doing eye surgery, orthopedic surgery, spine surgery. We're doing implantable devices, spinal implantable devices for pain procedures. We're doing some urology there as well. A lot of plastic surgery, a lot of elective plastic surgery being done at the surgery center. We have many very qualified plastic surgeons that are using the center. We've done cardiac procedures there. It's pretty extensive in terms of what we have done and can offer.
Yeah, that is a great resource. Community Surgery Center of Fort Lauderdale. It's scfortlauderdale.com. Great website. I got a lot of the information for the research on this show there. It was really easy to navigate, and that's important nowadays. And I will mention, Dr. Fox, you mentioned urology and cardiology procedures. I've had Dr. Ralph Zaga on this show about a month ago. Is the second time on the show. He does urologic procedures there, I believe. And also Dr. Muhammad Osman was on this program twice in the last 2 years. So, yeah, great doctors and a great resource for the community for an ambulatory surgery center. That is great. Tell us a little bit about, I read on the website you have 4 operating rooms there and 5 treatment rooms on site.
Yes, we have 4 very large operating rooms. Surgeons that come to our center, love the equipment and the size of the operating rooms, and the way things are set up really allows the patients to have a much better potential for good care. There are, in addition to that, there's the gastroenterology suites that we do our upper and lower endoscopies in. Those are outside of the operating room. We do not share the operating room space. They have their own special space for those procedures. And all of our pain procedures are done in the operating room, which are very well equipped, by the way. We have a lot of special equipment at the center. I would say our ambulatory surgery center has the best equipment you could possibly get for all our specialties.
Yeah, I was going to ask you about the technology, but it just speaks for itself. And then, you're JACO certified, and hospitals work hard to get that certification and to be an ambulatory surgery center, like you said, and have that certification. That is outstanding as well. How is the landscape? We got to ask this question. We're getting through this pandemic, all of us, but how has the landscape of elective surgery care changed in terms of, safety protocols at your surgery center, the Surgery Center of Fort Lauderdale?
Well, I'm very proud to say that from the very beginning of the pandemic, we made immediate changes in how we took care of our patients. Safety has always been our top priority. So I would say from the very, very first days of the pandemic, we took great care not to put any of our patients in harm's way or take any chances. And thank God, to this day, no one has had any of those problems at our center. We never completely closed down. Even during the pandemic, we were in a position to do cases that were urgent. We didn't want anybody to wind up in the hospital, and we actually provided a great service for hospitals by allowing people who did need care to be done at our surgery center and not burden the hospitals during those times. We have, from the get-go, had everyone in the center wearing masks. It's a very sanitized and sterile environment, if you will. All of our patients are required to wear masks. We have our schedule since the beginning very spaced out so that there's no overcrowding. There's never more than a few people in the center at any particular time. So the risks of spreading any potential problems amongst patients or staff is very controlled, and I'm very proud of how our administrative staff has taken care of things from the very beginning. We have amazing nursing staff at our center, and our administrative staff is second to none. And this is a center that runs an extremely efficient day-to-day operation because people are totally bought in, and everyone who works there really cares. And it's very obvious when you come. When you pull into the parking lot, it reminds me of the best academic centers I've been into in major urban cities. They don't maybe look the greatest at first, but then when you go in there, you realize you're in the right place because the care that's delivered and the level of excellence that really speaks for itself.
Again, it's scfortlauderdale.com. So that Surgery Center of Fort Lauderdale is the website. Ton of information there. We're here with Dr. Ira Fox. Dr. Fox, hold that thought. We're going to take a quick commercial break. Be right back. We're going to talk about a couple more questions I have for the Surgery Center of Fort Lauderdale, and then Dr. Fox's medical specialty, anesthesia and pain management, on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. An informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show. We're here with Dr. Ira Fox, Medical Director, Surgery Center of Fort Lauderdale. That's scfortlauderdale.com, as well as President and Founder of Anesthesia Pain Care Consultants, apccfl.com, with numbers in Tamarack and Boca Raton, 954-720-3188 in Tamarack and 561-338-3274 in Boca Raton. All the info's on those websites, though. Dr. Fox, couple more Surgery Center questions. What are some of the frequently asked questions people ask before surgery in terms of, day of procedure? Let's start there.
Well, they don't have to ask a lot of questions because we're very thorough in our instructions, but that typically will involve, they need a ride home, and we review the anesthesia they'll be receiving, how the procedure will actually occur, and we go through the details of everything they're going to experience pretty thoroughly. I think the questions that they may ask afterwards really relate to concerns about procedures that they would have done anywhere, to the procedures themselves. There are a fair amount of questions that come out lately as of the pandemic, and I'm very proud to tell them that we have taken all the cautions that I mentioned to you. One of the things that I also did not mention is we invested a lot of money in a very special surgery system for better airflow in our operating rooms. It's called Alluvia Aerobiotics. It's an ultra clean surgery system. So that's something that we added since the pandemic occurred. The surgery center has always, since day one, updated its equipment. All the anesthesia machines that are in there are brand new right now. We have the best endoscopy equipment you can get. The scopes were replaced. The screens are 32-inch color monitors for our gastrophysicians to use. All of our x-ray equipment, the C-arms that we use for fluoroscopically guided procedures at our center, an extremely important piece of equipment, are brand new. I personally was involved in the selection process for those machines. So, I'm very proud to look at what we're doing, what we have, and I think when patients ask questions and I explain to them what we have to offer, they ultimately feel really comfortable.
Yeah, and I've shared some of my experiences on the show. I've attended 8 surgeries as, pretty much part of the general public, and I've been in a couple surgeries with those C-arms, and those are state-of-the-art, amazing, imaging machines. That is really something to have at the ambulatory surgery center. I'm really impressed with that. Let's talk a little. So again, it's scfortlauderdale.com, Surgery Center of Fort Lauderdale. A ton of info there if you need the number or anything, any more info. Let's kind of change course a little bit and talk about specialty in your practice. Tell us a little bit about anesthesia pain care consults and some of the pain conditions you treat, the services you offer.
Sure. I started anesthesia pain care consultants with my partner, Dr. Jay Lasner, in 1996. I had been doing both anesthesia and pain for about 10 years before I broke away from the operating room to do pain medicine only. And since 1996, we have proudly seen over 100,000 new patients. This year, we saw patient number 100,000 in our practice. I have amazing and very capable doctors that are working with me at this time. Dr. Junaid Ozaktai, Dr. Javier Villasuso, Dr. Joe Alshon, and Dr. Robert Levy, who recently joined us. He's a world-renowned neurosurgeon who has really added a lot of extra expertise to our arsenal of ways that we can help patients. He's very advanced in devices that can help block and treat pain. But I think, we have come a long way over the last, since 1996, so 24 years. I am also president of the World Society of Pain Clinicians. I was on the executive board for the World Institute of Pain for 7 years. I'm an examiner for our board certification. I'm on the editor of a journal. So I tried my best to always bring cutting edge to our practice. At the same time, procedures that have been proven through studies and time proven with the treatment of patients. So I think we offer a very advanced level of service, a very caring level of service. And I think when we combine that with the staff at the Surgery Center of Fort Lauderdale, we have patients that have been coming there for over 20 years. Every now and then they'll show up for one problem or another, and we're very happy to be there to help them.
Yeah, you mentioned your team a few times at both the Surgery Center of Fort Lauderdale and Anesthesia Pain Care Consultants. And, to have great outcomes, you have to have a great team and a great leader like yourself who's, put in the time and effort. So that is outstanding information. Again, it's Anesthesia Pain Care Consultants, apccfl.com. We like to give out a lot of website information here, Dr. Fox, because we're on YouTube, we're on Facebook, but also the radio stations as well. So another interesting thing in your bio, which I'm a reporter by trade, and I really had a great time reading your bio and your resume there. But you hold five board certifications. Can you tell us a little bit about that and why it's important to? I was
not
off.
$5
Go ahead.
foot long. Not $5 foot longs. 5 board certifications.
Yeah, you got me there.
You said five. I couldn't help it.
Yeah, I could do the commercial in my spare time.
Yes, I'm certified by the American Board of Anesthesiology as an anesthesiologist. They have an added qualification examination for pain medicine. I'm certified there. Certified by the American Board of Pain Medicine, the American Board of Interventional Pain Physicians, and the World Institute of Pain. And listen, there are a lot of great doctors out there who may not have all those certifications. I think I did it more for myself as something that I wanted to do. I wouldn't say that just because I have those certifications, it has allowed me to take better care of my patients. I think I would have done that anyway, but they were very difficult challenges to get those certifications, and I am proud of them, and thank you for mentioning them.
Why did you decide to become a doctor and choose anesthesiology and acute and chronic pain care?
That's a great question. I went through medical school like every other medical student, looking at the different specialties available to me and what I may want to do. And it wasn't until I did my surgical rotation that I could really decide. I was very undecided. I didn't really have anything that caught out and grabbed me, if you will. So here I am, my first time in an operating room, and I see this doctor, injecting some medication into a patient's IV. He's, unconscious. He's put on a breathing machine, and he's undergoing general anesthesia for a surgical procedure, and he's basically taking care of this patient. And even though I was on a surgical rotation, I kept looking over that curtain, and I'm looking at this guy, and I'm saying, that's the coolest thing I've ever seen. I'm going to be him. I knew within 5 minutes of watching that was what I was going to do. And it's funny because I remember my first day in private practice in Florida, or rather the first day that I had put a patient to sleep, woke her up. She was doing great. I was wheeling her down the aisle to the hallway to go to the recovery room. And I remember thinking to myself, and I swear this is a true story, I was beaming. I was so happy. And I said to myself in my mind, I can't believe I'm getting paid to do this. I would do it for free. And I love doing anesthesia. What happened was I had a very extensive training to do regional anesthesia. The residency program that I trained in New Jersey, they wouldn't let us put somebody to sleep unless you can give a reason why you couldn't do a nerve block. And I became very skilled in a lot of different nerve blocks. In the 80s, interventional pain medicine was really an embryo. It hadn't developed yet as a specialty. When I went into private practice and these pain patients kept popping up, I was in a large anesthesia group. No one wanted to take care of them, and I kind of got involved, and I realized that my background in doing nerve blocks was very helpful in treating pain. And then I started traveling all around the United States and different parts of the world to learn from people who invented certain procedures back then, which really weren't being taught in residency programs yet. And started to dial that in and became very addicted in trying to get rid of people's pain. And as such, developed these skills in the practice and took it from there.
Well, Dr. Fox, this has been a fascinating interview. Sad to say we ran out of time. I didn't get to that last question, but it gives me a reason to have you on in the future. So thank you, and I really appreciate it.
Thank you. I really appreciate the opportunity.
Again, Dr.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.